Have you ever thought you had a yeast infection? Treated it with over-the-counter stuff and gotten zero relief? You're not alone, and it's incredibly frustrating. The truth is, what feels like a yeast infection might be something else entirely, like bacterial vaginosis or BV. Getting it wrong is super common because the symptoms can be tricky and overlap quite a bit, but guessing can make things worse and delay the relief you really need. So, let's break it down and clear up the confusion. Both yeast infections and BV can cause itching and irritation. This is often where the mix-up starts. You feel that unmistakable itch and immediately think, yeast infection. But hold on, the key difference often lies in the discharge. With a classic yeast infection, the discharge is typically thick, white, and clumpy, often described as looking like cottage cheese. It usually doesn't have a strong smell. Now, let's compare that to BV. The discharge with BV is usually thin, watery, and can be a grayish-white or even yellowish color. The most telling sign of BV is a distinct, fishy odor, which can become more noticeable after sex. While both can cause itching, the itching with a yeast infection is often more intense and pronounced. So, if the smell is the main thing you notice, it's leaning more towards BV. If intense itching and thick, white discharge are your primary symptoms, it's more likely a yeast infection. Another condition that gets thrown into the mix is trichomoniasis, or This is a sexually transmitted infection, and its symptoms can also mimic the other two. Trich can cause itching, burning, and soreness. The discharge is often frothy and can be yellowish-green, and it might also have a fishy smell because of this overlap. Especially with the smell, it can be easily confused with BV. This is exactly why self-diagnosing is so risky. You could be treating for a yeast infection when you actually have an STI that requires a completely different approach. So, how do you know for sure what's going on? The only way to be certain is to get tested. Your doctor can take a small sample of the discharge and look at it under a microscope right in the office. This is called a wet mount. They can see yeast cells, clue cells, which indicate BV or the Trichomonas parasite. This simple test gives an immediate answer. They might also do a pH test. A normal vaginal pH is acidic, but with BV or Trich, it becomes less acidic. Sometimes, they might send a sample to a lab for a culture, especially if infections keep coming back. Once you have a correct diagnosis, the treatment is straightforward. Yeast infections are treated with antifungal medications. These can be creams you insert, or a simple one-dose oral pill. BV, on the other hand, is a bacterial issue, so it requires antibiotics. These might be pills you take or a gel you use. And trichomoniasis, being a parasite, also needs specific antibiotics, usually a single dose of oral medication. It is also crucial that sexual partners get treated for a trich to avoid passing it back and forth. See why guessing is a bad idea? Using an antifungal for BV won't work and can actually make the bacterial imbalance worse. Not treating trich can lead to more serious health issues down the line. You end up wasting time, money, and you're still uncomfortable. Plus, repeated, incorrect treatments can lead to irritation and resistance. Your health is too important to leave to a guessing game. If something feels off, make an appointment with your doctor. Getting the right diagnosis is the first and most important step to feeling better fast. Thanks for watching, and I hope this helps clear things up. Don't forget to like and subscribe for more health content that cuts through the confusion. See you next time.